Welcome to Raaonline. Today's topic is diagnosis, screening and treatment of syphilis in pregnancy. So syphilis is a sexually transmitted disease caused by a spirochete, Treponema pallidum, and the transmission is by sexual contact, and vertical transmission from mother to child happens usually at around 16 to 18 weeks of pregnancy. So the stages of syphilis, as we know today, are the primary syphilis, the secondary syphilis, the latent syphilis and the late or the tertiary syphilis. So among the primary syphilis, we have a chancre here, and this chancre lesion is the hallmark of primary syphilis, and it may appear 10 to 90 days after the exposure or a sexual contact. Common sites include the penis, oral mucosa, anus, and without treatment the chancre will disappear in 2 to 8 weeks. Coming to the secondary syphilis. Now secondary syphilis is characterized by rash, and this is having pinkish or brown macules, and they involve the arms of the patient, or they may also involve the joints or soles in 50% of the cases. Now oral lesions in this secondary stage of syphilis can be seen as mucus patches inside the mouth. Now symptomatic early neurosyphilis, the cranial nerve deficits and aseptic meningitis can also be a part of secondary syphilis. Ocular syphilis manifestations include the anterior or posterior uveitis can also happen. Now genito-inguinal rashes, including the tinea mimicking rashes, and they heaped up wart-like lesions called as condyloma lata are also seen in the secondary syphilis. Less common internal organ manifestations of secondary syphilis include the acute hepatitis and the nephrotic syndrome. Now coming to the latent syphilis, it has been divided as early latent syphilis and the late latent syphilis. So latent syphilis refers to the asymptomatic infection, and after there is an asymptomatic infection after the period of primary and secondary syphilis, and this patient may be noticing it or she may not have noticed it. In the early latent phase, it is an asymptomatic patient who has a positive syphilis test. She may VDRL or RPL tested, and history is having a confirmed exposure, and patient did develop primary or secondary syphilis, and this early latent syphilis is treated with single dose penicillin. In the late latent syphilis, the patient have a positive RPR and a VDRL test, and they are also treated with penicillin. Now coming to the late or tertiary syphilis, now this happens long years after the latent syphilis, and this includes Tabes dorsalis, gait impairments and dementia. Tabes dorsalis damages the dorsal columns of the spinal cord and sensory nerve roots and causing a syndrome of pain and sensory deficit, and this Tabes dorsalis mimics B12 deficiency. Now gamma can happen in a tertiary syphilis, and they are ulcerative granulomatous lesions on the skin, bones and the internal organs. Now cardiovascular effects of the tertiary syphilis include aortic aneurysms, aortic regurgitations and coronary arteritis. So we have these kinds of stages in the mother. Now when the babies are born to these mothers, we have a syndrome of congenital syphilis. Now in congenital syphilis, baby can be born as hydrops fetalis, which is a non-immune hydrops. One of the causes of non-immune hydrops is congenital syphilis. Baby can have nasal discharge, hepatosplenomegaly, rash over the body, and this baby can also have petechial rashes, and the baby can have osteitis, metaphysitis, periosteitis, and there is a sign called as Weinberger sign, which is seen in the x-rays of these newborn babies. So during 16 to 18 weeks of intrauterine life is the time when the fetus get affected, and the baby can develop meningitis, baby can develop runny nose, hepatosplenomegaly, hemolytic anemia, thrombocytopenia, osteochondritis, periosteitis and rash. Baby can also have fetal demise and stillbirth. Preterm birth is also seen in these babies. Now when these babies grow older, they have developmental delay, sensory neural hearing loss, they have Clutton joints and they have sabration. And the babies also have signs of Hutchison's teeth and interstitial keratitis at a